I want to intro this clip. My work for the last 16 years has been about helping people adopt healthy habits and behaviors, activity, nutrition, mindfulness, sleep, and recovery. About 3 years ago for me, 2021, I began to realize the connection between psychedelics and helping people see their blind spots, where they get caught, where they get stuck, where they quit. And this researcher, Pedro Teixeira, is doing the research that is confirming what I've found over the last 3 years, that psychedelics do indeed help to fortify the ability for people to integrate these habits and behaviors. Listen to more.
Back to the Trip Report podcast, production of Beckley Waves, Psychedelic Venture Studio. Today I'm speaking with Dr. Pedro Teixeira, a researcher studying health behavior change and health psychology at the University of Lisbon in Portugal, and founder of the psychedelic educational nonprofit Safe Journey. About 18 months ago, I came across a paper authored by Pedro, Robin Carhart-Harris, and others titled Psychedelics and Health Behaviour Change, about the potential role of psychedelics to assist and promote positive lifestyle changes that are conducive to overall good health. And I thought that this would be an increasingly relevant area for research and practice. Part of my intrigue with psychedelics as therapeutic tools is the wide array of conditions and issues for which they may be helpful. At a time when the dominant paradigm in healthcare is a different pill for every ill, it's intriguing to see an emerging treatment that has been used for centuries and for which people have organically found uses for many different conditions, from PTSD to depression to cluster headaches. Furthermore, the idea that society's most pressing healthcare challenges, chronic diseases, are downstream of environment and lifestyle is an inconvenient truth, and the reality is that we can't ignore the impact of nutrition, exercise, sleep, our social environment, our relationships, and other non-medical lifestyle factors that can be difficult to change. So, can psychedelic-based approaches help people make positive changes, develop greater agency, feel less compulsion? These are the questions that Pedro and his team are researching. In this conversation, we discuss Pedro's research in nutritional science and health activity, the rise of environmental and lifestyle-based chronic diseases, the early years of the field of behavioral psychology, self-determination theory and the relationship between one's perceived competence and their motivation for change, the underlying psychological mechanisms of action in self-perception and health behavior change, the potential power of combining established behavioral interventions with psychedelics, and what we can learn about behavior change following psychedelic experiences in naturalistic settings, and of course the importance of psychedelic public education. And now I bring you my conversation with Dr. Pedro Teixeira.
These are really big questions, and the health and wellness of our entire society is based on finding solutions to help people live more healthy and rewarding lives. What I've found in terms of neuroscience, these compounds have a way of suspending what they call the default neural network. That default neural network is another way of saying our habituated patterns. So if we've got a habit around sugar consumption, or a habit around fast food, or a habit around alcohol, these compounds actually give us some relief at the neurological level to kind of disconnect those neural pathways and give us the opportunity to create new neural pathways, new habits, new behaviors, chosen consciously instead of unconsciously by default based on our past programming. This is powerful stuff. I encourage you to listen to the whole conversation.